A Step Ahead is an amazing program that has really helped so many of our patients. Walking into the room and not having to think about the finances is huge. It really just allows me to have a real conversation with the patient and really figure out what is the best method for contraception for them. A lot of the IUDs, the Unplanned, are quite expensive, and so if I had to really get into the nitty-gritty, it would be off the table. I mean, I've even referred personal friends. A lot of my husband's a musician, and so we've got a lot of musician friends who don't have conventional insurance.
I was trying to go through my insurance for years to get the Unplanned. I wanted it for so long, and my insurance wouldn't pay for it. It was like close to like $900, I think it would have been for me. So I literally made the call, I think the next day. I think I had my appointment for like that next week. Lana was really great, and she just like numbed it, but then it was so quick, it took like 5 minutes. I think everyone should support A Step Ahead just because so many women need this service. I mean, long-term birth control is so needed in this area.
One of the problems that we have in Middle Tennessee is insurance coverage of contraception, particularly long-term reversible contraception. A Step Ahead Foundation is a nonprofit organization that provides access to long-acting contraception for women who desire that, regardless of their financial status or their social status or their insurance status. This is something that is incredibly needed in this state. The problem we have in Tennessee is a very large unintended pregnancy rate. Unfortunately, a lot of the unintended pregnancies occur in a very young population and a population that doesn't necessarily have good access to health care. Being able to reduce these unintended pregnancies dramatically improves our ability to allocate our healthcare resources more appropriately. There's no question that availability, unrestricted availability of contraception has been successful in reducing unwanted pregnancies, and probably up to a third of abortions as well.
I think anyone and everyone should support a Step Ahead program because all women need access to long-lasting and free birth control. And I mean, I really can't imagine a world in which, if that was the case, all of the ripple effects. Like, can you imagine if women didn't have to have abortions or have pregnancy scares, that moment of panic? Having a kid is a huge decision, and 9 months is no time at all. You need to be preparing for years before 9 months. So if you're already pregnant and you're not ready, that's devastating. I chose to go with an IUD after trying multiple different methods of birth control because I have the hormone-free copper IUD, and it has blessed my life immensely. When you think of free healthcare, you might think, in and out, just not professional, but it was super professional. It felt very safe.
So since I got long-acting reversible contraception, I have been able to change careers. I have a new career path that I'm really invested in as a teacher. I've also purchased a home, and in addition to that, my goals now are establishing financial independence and becoming debt-free in the next couple of years. The experience was so simple. I called, they immediately got me connected with the local community health center. I had a great experience. I was taken care of. I was kind of coached through the process as well. The nurse practitioner who completed the insertion was really incredibly helpful and calming and reassuring, and I just felt so at ease. I can remember a time where I had to remember to take my pill every day. I can remember the stress of having forgotten to take a pill, because no one wants a pregnancy to disrupt an action plan. Anyone who is met with that situation, any reasonable person is going to want to completely shift all of their priorities, completely shift a game plan in their life.
We're a nonprofit in Murfreesboro, Tennessee, so we empower women to break the cycle of addiction, homelessness, and incarceration. So A Step Ahead actually comes into our pre-release programs inside of the correctional facilities, and they come post-release because our clients come and live with us. Our clients are new into their recovery, and so they're getting back on their feet. And sometimes they're starting new relationships, and so long-term birth control is super important for them. And especially something that's not like the pill where they have to remember to take it every day. Our clients are going through a lot while they're here.
Hi everybody, I'm with A Step Ahead of Middle Tennessee, and I'm here today to talk about some education and some free resources. What we're going to talk about next are what are considered long-acting reversible contraception methods. And these LARC methods are also over 99% effective. For example, the first one is going to be the implant. There's one brand right now and it's called Nexplanon, and I'm actually going to pass this around so you can take that and you can feel what it feels like in the arm. Next, we're going to talk about the IUDs, which stands for intrauterine device. The IUD and the implant are often considered the set it and forget it methods because they are placed by a provider, which means once it's in place, there's nothing to worry about. There's no pill every day, there's no going back to the clinics every month. It's in place and working for years at a time. Through A Step Ahead, we will actually cover the full cost of a birth control consultation, well-woman exam, and an STI test, completely free, along with the LARC method of someone's choice.
What I like about A Step Ahead's education is that we provide free access for women and young ladies about how to prevent pregnancies. There are grown women out here who may not have all of the knowledge that, we should have. It is, again, a taboo. Our parents didn't talk about sex and definitely didn't talk about sexual education. It was always, don't bring a baby in my house. So it was never necessarily like, these are the steps that you do to prevent. I wish that A Step Ahead was around in 2001. When I had my first child. I had a great college life, but then I got pregnant my freshman year. And so the shame of, you're pregnant, so what is my mom gonna think? And what would my church members think? And, my coaches and my teammates. And so the stigma of being pregnant, especially in college, I was a statistic. The father of my child, we're pretty good now, but then he was young too, so he didn't know anything really about raising children. And he was a student athlete too, so the thing about it is he had to go and play his sports. I had to drop out of mine. Because most times guys, can dip off, they can move away, they can continue their life, they continue to play sports. It's the woman who has to stop and put their life on pause to make sure that she's healthy and she's safe and her child is safe.
I support Step Ahead because they provide quality education and tools to women to give them a better life, a safer life. I remember asking my mom, why didn't you teach me about birth control? She was like, well, we shouldn't have had to. And I think that's a lot of women's experience. Having a healthcare professional in a safe place just show me my options and then be like, yeah, you can pick any of these at no cost and we will safely give it to you. It was such a gift.
So what I also really love about A Step Ahead is that they're not only just covering birth control, it's also about STI checks, pap smears, kind of the whole person. Being able to communicate about complications, getting ultrasounds paid for, even with the transition into telehealth, being able to get telehealth covered for, I felt like the staff at A Step Ahead is very adaptable and always trying to be flexible. And I'm passionate about working at Neighborhood Health and collaborating with A Step Ahead because I really want to empower patients and empower women and trans men to be able to live fulfilling lives. We serve such a diverse community that we can really improve health equity through our collaboration. Being able to be in control of when you get pregnant, it will help the woman, but it also helps the family, and then in the end, it helps our community. Investing in A Step Ahead is investing in your community.
This is why this organization is phenomenal and it is needed in our community and in our nation. I encourage you to support A Step Ahead because little girls like me need the foundational resources and education to become great women.
Hola, mi nombre es María. Estoy muy agradecida con Un Paso Adelante por la atención médica recibida, la asesoría y todo el cariño brindado. Retomé mi vida a mi manera, soy feliz. Gracias. Un Paso Adelante por comprender a las mujeres. De verdad, podemos acudir a ustedes sin duda. Vamos a ser comprendidas, respetadas y atendidas. Muchas gracias.
I support A Step Ahead's mission to provide free education and access to long-acting reversible contraception. Because at a time where I needed it most, I needed security, I needed peace of mind. They provided it with no questions asked, no expectations. All I had to be was a resident. And in turn, I now am in a position where I get to spread the word, and that's all I want to do. It's an incredible foundation. It's an incredible support to women, and women deserve the security and the freedom to start a family with intention and without surprise or worry.